Hi, I'm Dr. Joe Niamtu, LoveThatFace.com. Thank you so much for watching. We almost have 20 million views on our YouTube channel, and I just spend so much time talking to people all around the world via YouTube, and it's awesome. So, you know, I only do cosmetic facial surgery, and I don't do boobs, bellies, and butts, just from here to here. And the procedure we're going to talk about today is otoplasty for people with protruding ears. And of all the procedures we do, it could be one of the most emotional, because so many patients, like the patient I'm going to show you here, especially when they come in as adults, maybe their parents couldn't afford surgery when they were young. See, we do a lot of children at the age of 4, 5, 6, but there's some adults that have protruding ears. They had them all their life, and you know, their parents couldn't afford the surgery, just like they couldn't afford maybe braces for their teeth. And the thing about protruding ears is people can make ungodly fun of these patients. The pure ridicule starts in preschool, and they start making fun of these children, and these children become, their self-esteem can be greatly affected. And there are many studies that show that this can affect the child for the rest of their life. Of how they feel about themselves and their self-esteem. And so this is a patient, it's pretty touching. He reached out to me, said he'd been bullied literally all his life, and he wore his hair long so to hide his ears. Then he went into the military, and they cut his hair, and then he got bullied in the military. And one of the greatest things for my staff and for me is when we do a surgery like this and we take off the dressing the next day and that patient looks in the mirror for the first time. So I've got a lot of emotional videos, and you know, some of them are funny. They're a 4 or 5-year-old and they look in the mirror and say, whatever. But this is very emotional, and this is the kind of situation where at the end of the day, when I go to bed at night, I'm so thankful that I have the ability to do this. I love what I do. A lot of people wait for Friday. I wait for Monday so I can do cosmetic facial surgery. So stick with us. We're going to show you this video. I'm Dr. Joe Niamtu, LoveThatFace.com. And every patient has a story. Today, we're with Rusty, who reached out to me some time ago and shared kind of a touching story with me about how he was bullied a lot of his life because of his protruding ears. And we see that a lot. I've done a lot of videos on that. And we're going to just find out a little bit about his experiences and his motivations and what led him to seek corrective ear surgery.
Well, since I was very young, I always wore my hair long, over my shoulders, over my ears, never took it short. And I think every picture that I have, they're all long hair, so nobody could see that my ears were protruding. After high school, I decided to join the Air Force, and then I couldn't hide it anymore. Had my hair shaved, and went through a lot of teasing and picking on me. So this is something that I've been looking to do for a long, long time, and now I'm 50 years old. It's time.
So Rusty, you know, it's always touching, and of course, a lot of people, this starts when they're very young. So I'm going to ask you to kind of tell me about your earliest memories and maybe how this affected you when you were a youngster or in early school.
My younger days in high school, I think a lot of people just would nickname me Ears or flick me in the ears as I walked down the hallway, just taunting and teasing me up until around 6th grade. And that's when I started to grow my hair out long, and high school wasn't quite so rough. Only a few people could tell at that point, and most of those were fairly decent friends by then, and they didn't tease me quite so bad.
So people actually physically flicked your ears?
Yeah.
All right. Well, we're gonna, I appreciate you putting your trust in us, and we're gonna fix that tomorrow.
Good.
And hopefully change your life.
I'm ready.
All right, very good. Well, we'll tune in tomorrow preoperatively and follow Rusty's journey here. So what a difference a day makes. Here we are 24 hours later. We did bilateral Davis and Mustard otoplasty yesterday on Rusty. So how was your night?
It was, I slept fairly well on and off. It was just mainly due to learning how to sleep on my back. I'm a stomach sleeper.
That, you know, that is a big problem for patients, and I've been there myself when I've had knee surgery. I'm a side sleeper, and trying to sleep on your back is hard. What do you remember about your surgery?
The last thing I remember is the mask.
Right.
And I can remember a faint smell of some odor, and that, I don't remember anything else.
Okay, very good. How about your pain? Did you have much pain last night?
Last night it was probably a 5 or 6. Today it's about a 2 or 3. I don't feel very much pain today.
Very good. So what we're going to do, we're going to take your bandage off and clean everything up and give you a mirror and let you take a peek at your new ears.
I'm ready.
All right, very good. So this is perhaps my favorite part as a surgeon, is when a patient, how old are you, Russ?
50.
50. So for half a century, Rusty's been looking at protruding ears. So let's put the mirror up and take a peek and tell me if you can tell the difference there.
Wow. Thank you.
It's our honor, buddy. It is absolutely our honor.
That's what I wanted.
Well, I'm so happy that I have the skills and the staff and the ability to do this for you, and it's our honor to do it. Can you tell the difference?
Yeah, I like it.
All right.
Wow.
All right, buddy. Well, those are your new ears. They're gonna be a little pushed in because of the bandage that you had on overnight, and your lobes are a little swollen, but I'm very pleased with it, and I think it's going to be a home run, and again, I'm honored to be your doctor.
Wish I would have done it years ago.
Well, can't look back, but here we are, and it's our pleasure. And again, this is one of the reasons that I really love my job, is to be able to help people like this and make them look and feel better about themselves.
Day one pre-op was like walking into a spa, the office setting, and all the staff there are just wonderful people. I couldn't have asked for a better group of people to take care of me. The day of the surgery, no pain at all. I don't even remember the surgery happening at all. All I remember is going into the operating room and waking up in recovery. I'm now at 2 weeks, and I'm all healed. Just had my hair cut, and the beautician told me that she didn't even notice any scars, didn't notice any stitches or anything. So from what she's telling me, that I'm completely healed up. There's still a little bit of discomfort, but only when I'm sleeping, because I lay on my side. But after 2 weeks, I'm amazed that I'm healed already. So anybody on the fence concerned about the pain or discomfort or anything, it's not that bad. It's really not that bad at all. And I'm so glad that I found Dr. Niamtu, and glad that I was able to get this done. I love it, and wish I would have done it years and years ago, but now it's done, and I've got this to look forward to for the rest of my life. So Dr. Niamtu, thank you so much, and thank your entire staff for me. I appreciate every one of them. They're wonderful people. I don't know how you found that whole crew, but good job. Good job.